to More Living with Jim Brogan, your source of information for living the best years of your life your way. For more than a decade, host Jim Brogan and his expert guests have come together each week to share important news and advice that can impact the lives and well-being of those who are retired and those nearing retirement. Learn about issues like health and fitness, financial planning, Social Security benefits, investment advice, and more. And now, here's the host of More Living, Jim Brogan.
Good morning, East Tennessee, and welcome to More Living with Jim Brogan, where it's all about living the best years of your life your way. You're listening to News Talk 98.7 WOKI this morning, and wow, I wasn't live last week, and so much has happened just in the last 2 weeks. It's just unbelievable what's happened in the world, and I know there are two big concerns I'm hearing from people. Of course, the number one concern is people are worried about their health. And people are also, though, worried about their wealth. And we're going to hit both of those topics today. What do you need to be doing on the health front? And what do you need to be doing on the wealth front? You know, there's so much information out there now from news outlets, social media, emails. There's a lot of rumors, a lot of conflicting information. It's just hard to know what you need to listen to and how far you need to go to protect yourself and your loved ones. So today, I have emergency medical physician Dr. Phil Seifert on the phone with us. His specialty is emergency medicine, so they're certainly gearing up for everything. You know, what is he seeing? What is he expecting to see? What are they doing to gear up? And so in this first segment, we're going to visit with Dr. Phil Seifert about what's going on here in the local area. Good morning, Dr. Seifert. Welcome to More Living.
Good morning, Jim.
It's great to have you with us. Thanks so much for calling in. Let's start, Dr. Seifert, with some information that's come out of Tennessee lately. You know, there's been so much focus that this virus is so much more dangerous for people that are either older or have underlying healthcare conditions. But the numbers I've seen from the state of Tennessee show there's been a surge in positive diagnoses among younger people. Can you just talk a little bit about what you're seeing or hearing's going on in Tennessee with who's getting infected?
Well, fortunately for us in East Tennessee and the Knoxville area at the present time, we really haven't had very many cases. But we are seeing that younger people are certainly getting the disease. But I think the thing to remember is that young people typically are getting milder forms or not having the severe illnesses that come from the disease. But we're discovering that as we do studies and throughout the world, that younger people have it. A lot of people may be just even asymptomatic or very minimal symptoms with it, so it makes it hard to truly detect and truly prevent the spread, and that's the big concern with the younger population or any part of the population.
You know, Tennessee, Dr. Seifert, was kind of called out this week nationally on the news about not doing much. Do you think people in Tennessee are taking this seriously enough?
I think as things progress, you know, everything's in a fluid or in motion. We are revving up. We are doing things. I think when it's not right in your home right away, you're trying to get everything prepared, and I think we're doing everything we can to get prepared. You know, what they're doing in different states compared to what we're doing here, that's hard for me to tell you. But, you know, we're doing everything in our facility to get ourselves ready to be as best prepared as we can. But so much of it, and I don't mean this to shift the focus here. So much is people just staying at home, staying safe, so that we, as the healthcare providers, can provide the best service to the least amount of patients that can have this. Because what is going to happen, unfortunately, if this continues to spread throughout the world, throughout the United States, throughout Tennessee, if so many people get the virus, we just don't have enough medical supplies and resources to take everyone potentially who might get this. So really staying at home, preventing the spread is just such a key thing to letting us take care of the patients that do get this virus and helping out and saving as many lives as we possibly can in Tennessee, in the United States, in the world.
Well, and we certainly have seen even here in East Tennessee, at least with what I've seen in the community over the last 2 weeks, I do see people getting much, much more serious. Now, what are you seeing at your emergency room? Are you seeing a lot of people coming in concerned that they have symptoms, or has it been kind of calm right now?
Well, I mean, that's a very good point, Jim. I mean, people unfortunately don't know what the symptoms are. As I said, we're discovering, or the testing out there is discovering, that people can be completely asymptomatic to having very minimal symptoms, a little scratchy throat, runny nose. So you don't know who has this, and that's very scary. The thing with this, unfortunately, at the present time, we don't have accurate testing in the sense that we don't have immediate testing for the coronavirus. So what happens, you can come in and the test results will not be back for 3 to 5 days. In those 3 to 5 days, if people are not self-isolating or quarantining themselves, the possibility that if they have it and spread it, or if they don't have it and they're exposed to somebody else, makes it a very difficult way to contain the virus, because we don't know what could happen in those days when we're waiting on the test results to come back. I think the bottom line is, unfortunately, right now, we don't have the amount of tests and the accuracy, again, in time frame of the test. So it's best really just for everyone just to isolate themselves. If someone thinks they have the virus, the best thing is probably, just as I say, to stay at home, isolate themselves from other friends, family members. Do everyone need to be tested? I don't believe we're seeing that that's necessary, because, again, most people, 80% of the population, will have very mild flu-like symptoms, do very well. If there's questions or concerns, call your doctor. Ask your doctor, what they recommend. But for everyone, it's not at this point necessary or practical for every patient to be tested to see if they truly have the virus, unfortunately. We hope that we get better testing out there here very shortly.
So if people are at home and they're worried about symptoms, because 80% of those infected have had mild symptoms, I guess, what we're hearing is so much worry about stressing the healthcare system with too many people. So if people are having mild coughs or whatever, a small fever, the first thing is, don't just rush out. Just call your primary care doctor and stay in the home and get guidance at that point.
Right, because unfortunately, there's not a real treatment for if you have a mild cold. The coronavirus has been around for, like the flu virus, and unfortunately, there's different strains that come through, and this is a different strain of the coronavirus that's come through, and when it hits the elderly, the immunocompromised, it can have the severe respiratory complications, and people can unfortunately die from those. But for the majority of the people that get this, again, can be minimal symptoms, like a mild little cold, and they'll get over it. So to just have those symptoms, stay at home, protect other people that you love, not socialize, not go around with anyone, and just, if things get certainly more serious, you're having more symptoms, again, calling your doctor, then in those instances, coming to the hospital or getting further treatment at that time.
So if the fever really spikes or somebody starts to have difficulty breathing, that's when they need to really, truly seek medical care.
Absolutely.
Yeah. Now, what at your emergency room, I guess y'all are gearing up for this. I mean, what are you all expecting? I mean, I guess it's kind of an unknown, but what are you gearing up for?
I mean, unfortunately, we have to gear up for the worst, so we have to have preparedness for the different levels of, from patients coming in, with different symptoms, how we triage them, how we segregate people, how we further, identify who has, unfortunately, the virus, and, how we're going to take care of them, and having the resources as best prepared as we can, from emergency services to inpatient services to expanding, other areas of the hospital to help contain and control any further spread of the virus as best we can.
So, Dr. Seifert, how would you encourage our listeners in terms of both encouraging them of how we're getting our arms around this, but also underscoring the seriousness of it? I mean, what would be your word to our listeners?
Well, when we talk, people say, flu killed people. Well, yes, flu killed people about 1 in 1,000. The coronavirus has the potential of killing 20 or 30 out of 1,000. And when we think that the potential of spreading in the American population to half the population, they may say, we're talking about the possibility, I never hope anything like this happens, of 5 million people being affected or being killed by this. That is an outrageous, horrific number to be talking about. The best way that we can handle this, because we don't have the proper testing at this point yet, is everyone to self-isolate. And that means you don't know if anyone you visit, they look perfectly healthy, they don't have the virus. And you may be perfectly healthy, and you visit someone who is immunocompromised or someone in a family who then spreads it to someone who's immunocompromised, and they get the virus and they can get sick and die, which is we don't want to happen. So really, it's strict social isolation. Stay at home. There's really no need to visit with anyone. You can, talk to people on the phone. You can do Skyping or FaceTime, but we really have to isolate ourselves so we are not spreading this between our loved ones and spread it to someone who's susceptible to getting the severe infections. So that is really the key. And we don't know who has it right now. And until we know how to separate people into quarantine, we just have to do this. And it's not easy. It's not easy telling your kids, your young kids, that can't have playmates. It's not easy telling the teenagers that they can't go out and play. They're fine. Why do I need to stay home? Because if you go out and you go out with a friend and you get something and you bring it home, and a grandparent, a great aunt, uncle, someone may get that from the family, and we don't want that to happen. So strict social distancing is so important. The last thing I want to ask you is about cleanliness. Can you just talk about, the difference in hand washing with soap and water, old-fashioned, versus hand sanitizer, how we handle our clothes, and how we wash them? Can you just talk about general sanitation, what we should be doing to be extra cautious? Sure. I mean, ideally, if we're out in public and we have to go to that essential things of going to the grocery store, getting our medicines from the pharmacy, those things that we have to go at our home. The key is when you're out there, you're trying not to, if you're touching things, it's just on your hands. But if you touch your face, that's how it enters your body, through your eyes, your mouth, your nose. So very difficult to do, but try not to touch your face. And if you have to touch your face, use a hand sanitizer when you're out to do that, because you're not going to have soap and water. Soap and water is really the best for, to break down those viruses, but hand sanitizer did an excellent job. But you just want to try to minimize, if it gets on your hands. Just think if you touch anything, it's sort of it can be on your hands. So you just don't want to touch your face. You want to hand sanitize as best you can when you're out. When you get home, you immediately wash your hands, and then hopefully then when your home is your safe place, and that's when you can, then you're okay to touch yourself or touch your face, but you haven't brought it back into your home. It does last on surfaces. We are aware of that it can last. So certainly, you try to minimally bring things in your home or wash things down is a possibility, but that's not the real concern. It's really, the hand touching, but we want to limit anything we're bringing, in our home, people-wise, other things, just to minimize the ability to bring it into the home and then stay there and stay safe. I do have one final question, Dr. Seifert. Thank you so much for your time. There's a lot of buzz right now. It's even in the main news stream about anti-malaria drugs. What have you seen or read in the medical community? Do we know much about that? Yeah, I have not read that those have been effective at the present time, but certainly in the medical community, we're trying anything and all things possible and different. There's starting with vaccine trials or trying any kind of medicines, from different antiviral medications and anti-malaria medications. I have not heard that those have been effective, but it's so hard to decipher the information. It's a very fluid motion of trying to see what works or what may help. And as of now, I don't know that these are definitely things that have helped. Yeah, well, luckily, I think all private industry and the government is working together to do everything they can to try to speed things along so that we can get some treatments and some, vaccines and the whole 9 yards. Dr. Phil Seifert, an emergency room physician right here in Knoxville, thank you so much for taking time out of your schedule to call in today. Thank you, Jim, and you stay well and healthy. Thank you. You as well. Tell you what, when we come back, we're going to get into our wealth. The economy has entered into a bear market. We've seen crazy market conditions. Is this different? How is it different? Certainly the healthcare crisis is different. What should you be doing with your money? And so don't go away. We'll have that when we come back as you listen to More Living with Jim Brogan, only on News Talk 98.7 WOKI.
You are listening to More Living with Jim Brogan. During the week, Jim is a financial advisor, an author and speaker with an MBA from the University of Tennessee, who specializes in helping people in or near retirement plan for the next phase of their lives. You can reach Brogan Financial during the week at 865-862-6800 or on the web at broganfinancial.com. And now, here's Senior Market Advisor Magazine's 2011 National Advisor of the Year and host of More Living, Jim Brogan.
Thanks for tuning in to More Living here on News Talk 98.7 WOKI. I'm your host, Jim Brogan. And that was a great segment with Dr. Phil Seifert. We will have this show podcast on my website. Go to broganfinancial.com. click on radio, and you can listen to this show. If you missed that first segment, it was great information. We're going to talk about your wealth now. The economy has officially entered into a bear market. The stock market has, after a just shy of an 11-year bull market run. A bear market is actually a technical term, and it means that the market has fallen over 20% from recent highs. And bears get a bad reputation because when they attack, they swipe down with their paw, as opposed to bulls who lift up with their horns. Bear markets can be long or short. It's certainly unclear how this one will last. The market could fall further. No one knows when it will hit the floor. As is often the case, recent market volatility is largely influenced by a lot of things. And so in this instance, certainly the coronavirus is the main cause. However, we've had it compounded by an oil war between Russia and Saudi Arabia. And so we've got several factors kind of coming together there. People were already skittish about all-time market highs. So then there was a lot of panic that got mixed in. We saw a little bit of that die down this week on Thursday and Friday, although the last hour and a half Friday in the market, there was certainly a little bit of panic that got right back into the market. But you should have a plan to protect your savings in market downturns. And it's especially important if you're nearing or in retirement, as you have less time to rebuild your nest egg in the event of a market crash. So it's also important to note that there are often sharp rebounds after downturns. And some examples of this have been the Russian sovereign debt default in 1998, the 2011 Eurozone crisis, where stock market declines were followed by rapid rises. So, the Fed has stepped in an attempt to boost the economy. They've cut interest rates. They're pumping billions of dollars into the economy. So what should you be doing? And where are we likely to head? So let's first start. I want to just kind of give you my overview. And I don't want you to get me wrong. First off, nobody has a crystal ball. So we don't know where this is going. You have some people out there saying in a month or two, we're going to get through this and we're going to have a hockey stick recovery in the stock market. So in other words, it's just going to skyrocket in a month or two, which to me is on the more optimistic side. And then you have others saying this is going to turn into a depression, worse than the Great Recession, the worst economic conditions, that this will turn into the worst economic conditions we've seen since the Great Depression in the 30s. I'll be honest, I think it's going to be somewhere in the middle. I do think both of those, both the rosy scenario and the gloomy scenario are possibilities. I mean, something could happen on the medical front a month from now, and we could absolutely see a remarkable rebound in the markets. Just technology alone. At the same point, there's a chance this could go into depression. I mean, there's a chance of that. So I don't think that's what's going to happen, but there's a chance. So it's kind of confusing time. We know that market panic, it's never a good idea to panic and sell investments in the midst of a panic. And frankly, at this point, it's too late to try to just go to cash. I think that'd be a big mistake in how you're handling things. But I do think it would be a mistake to just do nothing if you haven't already prepared a plan prior to this happening. So let's just talk about this a little bit. This could be a short bear market. It could be a deep, deep recession. On average, a bear market with the Dow Jones lasts 206 trading days. When you look historically at a calendar, like how long from the high to the low, 9 months. 9 to 12 months is kind of normal. Could be 15. In the Great Recession, from the high in 2007 to the low in March of 2009, there was a 16-month window there. So, But usually it's 9 to 12 months. Let's just say 9 to 15 months. And, bear markets, no matter what the bear market is, they are always ugly. And everybody always feels like, oh my gosh, how are we going to get out of this? We see this in the markets every so often. On average, since 1900, the U.S. stock market drops more than 20% about every 8 to 9 years. And the average loss in a bear market is over 40%. Now, right now, we're a little over 30 from the high. So we're not even, if the thing ended right now and we, let's say we bottomed out and then there was a recovery, this is less than an average bear market in terms of where we are right now. But it seems so bad right now, doesn't it? And you know what it did in the financial crisis of 08? That bear market started in August of 07 was when we started having a lot of cracks with the mortgage crisis. But it really reached a peak in October of 08, and then we didn't actually get to the true bottom until March of 09. And then you go back, we had the tech bubble burst in 2000. Then we had 9/11. We had 3 years of market decline, which is the only time since the Great Depression we've had 3 calendar years in a row where the stock market was down. It's very unusual for the stock market to be down even 2 years in a row, much less 3. So, I don't want you to get me wrong here. This is a very serious matter in this market. And by the way, I'm not demeaning. It's a very serious healthcare. We have a healthcare crisis. We have a human crisis on our hands. So I'm not trying to diminish the human and health side, but the wealth side, most of you are very worried about it. And that's what I do for a living. That's what I do in my office. That's what I study. I've been in this since 2000. I started my firm in the summer of 2001 and immediately, then we had 9/11. So I saw 2 bear markets in the first 6 years of my business. So, I've been through this. I know how they appear and how they feel. Now, are there differences in this one compared to others? Absolutely, there are differences. There's always unique things about all bear markets, and the sharpness, the rapid drop that we've had just in the last 3.5 weeks has been just unbelievably dramatic. But it always seems bad. Now, I'll be honest, I think that this is going to last for a while. I think we're definitely in recession. We won't have that confirmed until July because a recession is 2 consecutive quarters of economic contraction where GDP growth is going negative from the previous quarter. So, we won't be confirmed until July, but there's no question in my mind we're in the start of a recession and it's going to take several months to play out. It could go deep into the fall. It could even be a year. And if it turned into a depression, it would be very, very severe, obviously. I don't think it's going to end up there. I think it could be a deep recession. Now, ideally, you've already got a plan to deal with this. And when you're invested in the stock market, first off, you shouldn't just be invested in stocks. When you're invested in the market, you should be extremely diversified and balanced. So you don't just have stocks. You have other things that, what diversification really means is you have a whole lot of stuff in your portfolio, and if one thing zigs, another zags. So if one thing, like stocks or stock mutual funds, is way down, hopefully they're not all way down. Now, when you have a crash like we've had in the last 2 weeks, there's almost nowhere to be safe. Everything goes down. But once the panic subsides, the balance of the diversification typically returns. Okay? So, you should have more diversification. And then the other thing is, stock market at-risk investments should be long-term investments. You shouldn't invest money in the market that you're going to need to draw from a year from now or 2 years from now. You should be looking out at least 5 years, if not longer. Okay, so, if you've prepared for this and you've measured risk, that's what we do in our office. We've prepared our clients for this before it happens. That doesn't mean it's not a shock, and that doesn't mean people aren't concerned. It does mean that the investments that are in the market right now, number one, shouldn't be going down as much as the market, and number two, our clients aren't drawing from those investments right now. And we have safe investments or stable investments that are not sharply down, that are helping buffer the blow and provide a source of short-term income or cash needs. So a good financial plan addresses these things before they happen. But what if you haven't done that? You're in the midst of this. Maybe you're near retirement or you're already retired. Or what if you're 8 or 10 years from retirement? What in the heck do you need to be doing? Don't panic and sell and go to cash, but I think it'd be a mistake to do nothing. So don't go away. When we come back, we're going to talk about what can you be doing. And then later in the program, I'm going to talk about the danger of low interest rates as we look to the long term, 20, 30 years of your retirement. And we're also going to talk about how can we help people in need that are suffering and that need help right now. How can we as a community be helping others that have needs? So please don't go away, as we'll have all of that good stuff when we come back here on More Living with Jim Brogan. This is News Talk 98.7 WOKI.
Through his weekly radio show, television news appearances, and adult education classes taught at the University of Tennessee and Pellissippi State Community College, Jim taps into his extensive knowledge and experience to address issues important to living your best retirement. Join Jim every Saturday morning at 9 a.m. here on News Talk 98.7 WOKI, and visit him online at BroganFinancial.com. And now, here's the host of More Living, Jim Brogan.
This is More Living with Jim Brogan, where it's all about living the best years of your life your way. It's News Talk 98.7 WOKI. And we're talking about your wealth and the market conditions we're in right now, and what in the world should you be doing. Hopefully you've had a plan that measures risk and addresses all these things before this happened. If you don't though, or didn't, what do you do now? We know that market timing doesn't work. We can't time highs and lows. Now, I will tell you this. I think there's going to be opportunities from an investment perspective that come out of this. But the first step fundamentally is, what do you do? You're almost retired, or you're already retired, or maybe you're 8 years to retirement, and you really haven't prepared for this in terms of a financial plan ahead of time. What do you do? We know market timing doesn't work. You shouldn't panic. I also think it would be a mistake to do nothing, as I mentioned in the last segment. I think that this is going to be a challenging several months or more. And the market's bound to be very volatile. I think that there's likely to be fake rallies before we establish a true bottom and know what that bottom is. And then even from that established bottom, there might be some fake rallies only to go back down. But we just never know. And so, it would be a mistake to panic, and then there is a recovery in 2 or 3 or 6 months, and you're not participating in that. But at the same point, you have to be prudent. And here's my big thing. I think, first off, you have to look at, what is your retirement plan? When are you going to need money? And actually, if you're not retired, if you're 10 years from retirement, if you're 15 years from retirement, you have to look at what are your short-term needs for money, your short-term cash needs. And frankly, that money should not be exposed to market conditions. Now, one of the things you've heard me talk about many times over the years is that you ought to have a minimum of 5 years worth of income secured from right now today. That is not subject to market conditions. So if, that would be an emergency fund if you're younger. If you're saving up for a car purchase in 2 years, same thing. Or if you're saving up to get a new house or do a down payment in the next 5 years, that money really should not be exposed to the market. But what do you do if we're in the midst of this and you've got most of your money at risk? Maybe it's got some balance and diversification, but you're seeing deep losses and you're wanting to retire, in the next 1 or 2 or 3 years, or you just retired. I think that, setting aside going from these losses to setting aside 5 or 7 or 8 years worth of secure income would maybe be an overreaction. But I do think at a minimum, you've got to secure 2 or 3 years worth of income. Ideally 3 or 4 years. I think all you can do is look at, where are you right now today, and can you take control of your ability to retire successfully? Or if you've just retired, can you take control of your ability to stay retired successfully? And if you can, if the numbers work, and you're not drawing too much income off of your hard-earned life savings, and you can secure the next, say, 3, maybe 4 years of income, I don't know why you wouldn't do that, but at least 2 to 3 years and secure that income. And then you've got to measure the risk in the rest of the portfolio and determine how much are you willing to deal with moving forward. If you're still secure, if you still have the type of nest egg to secure everything in retirement, I don't know why you wouldn't go ahead and do that. You'd want to be smart about how you rebalance and reposition risk investments. You might want to implement things in phases. But if you are secure now, even with the dips, I don't know why you wouldn't go ahead and do that. If this has threatened your ability to retire successfully on your terms, I think you start securing a little bit of shorter-term income, and then you're very measured and calculated of how you measure risk in your portfolio and how you invest to balance risk at an appropriate level moving forward, where you've got a little more stability on the downside potentially, but still have great growth potential if and when we see a dramatic recovery. So I think that this can all be accomplished. In our office, just because somebody hires us doesn't mean they're liquidating all their investments. It means that we're going to start managing the process and doing a financial plan to help them be successful. And so a lot of that is determining, you should be right now today developing a financial plan if you don't already have one that addresses all of these things I'm talking about. You should develop that financial plan now. Now, the implementation of that plan needs to be very measured and calculated. And that's what a professional's for. We can't, we don't have crystal balls. Nobody knows what's going to happen. We know how to take measured, smart, calculated decisions and guide you and lead you along the way. Okay. So that's what's needed right now. So that's what we do. Now, I do want to mention one thing. What about preparedness? This is a question that I've gotten from people I've run into in the community that I know, or that, hear me talk and like, hey, you do that radio show on Saturday morning, is, hey, what is, when you're overseeing people's life savings, what is your preparedness for the reality of, we don't need people coming into our office right now. We don't need all of our employees to be at our office right now. We've got to be protecting everyone. We need to be protecting our clients' health. We need to be protecting our own health, our employees' health, and people in the community. So I want to tell you right now, we have 100% full capability to be 100% virtual. As a matter of fact, indefinitely now, but at least for 2 to 3 weeks, we are doing all of our client appointments virtual. We've got full audio and video conferencing capability. We can share materials securely. Our clients can share materials with us securely. We have all of those tools in place to be completely virtual. We could have everybody work from home if we need to. We're all connected. We have all the security protocol on our home networks and computers. Well, they're business computers that we take home, but we have all the protocol in place on all of those devices and networks. So we're business as usual. This isn't going to affect us, and it's not going to affect our ability to serve you or to serve our clients. We can do it all virtually, and we can help people begin creating financial plans to be successful and be the guide that you need to get you through a very, very challenging time. Okay? I think there's a way to do this and a way to not do it. Everything depends on your individual circumstances. Everything could be affected. I'll be honest, your Social Security strategy might change because of this. Because delaying Social Security if you're about to retire, this is just one little thing that comes up. Is you may be thinking, you were going to retire next year, or you just retired and you were going to delay your Social Security for several years. But you haven't secured short-term income, and the market investments are way, way down, and you've got to be very calculated about how you handle things to not make a mistake and get your nose bloodied. Well, your Social Security strategy might need to change. And you can go on Social Security and your benefits discounted, and then you can stop it and it'll stop being discounted. You can, you can't reverse it if you've drawn for more than a year, but you can stop it and stop that discount and then start to delay again. So there are a lot of things. Tax planning is a big thing right now because investments are way down, and there's opportunities right now for tax planning with making smart decisions to take advantage of tax realities. Not to mention the opportunities in the investments world that are going to likely evolve from all this. So there's so many financial things that come into play here. And, don't just sit and do nothing. You need a financial plan where you can address this volatility and make wise, smart, prudent decisions. Now, when we come back, I'm going to talk about what can we be doing to help each other. I've got 6 ideas here from an article that I have been perusing. I've been just absorbing so much information online, but I got 6 ideas for what you can be doing to help others in what is inevitably going to be a very trying time. It's going to get more trying and harder for some people. What about our medical side and our supplies? There's a lot of things we can be doing to help the medical community, to help local business, to help local outreach. So don't go away. This is More Living here on News Talk 98.7 WOKI.
Thank you for listening to More Living with Jim Brogan. If you miss any of today's show or want to listen to it again, visit BroganFinancial.com, where you can access the podcast and other educational materials to help you in your journey through retirement. And now, here's Senior Market Advisor Magazine's 2011 National Advisor of the Year and host of More Living, Jim Brogan.
Thank you for tuning in to More Living here on News Talk 98.7 WOKI. I'm your host, Jim Brogan. Do check us out at BroganFinancial.com. Our radio shows are podcasts there. Click on radio. We've also got our retirement minutes and our dollars and cents segments. By the way, our college classes, you may be wondering, because nobody's meeting in person anymore, we are working on virtual offerings. We are going to be offering the one that was going to be in Blount County in April. Through Pellissippi State, we're going to be offering online virtual learning. All you need is an internet connection at your house. We're also working with the University of Tennessee, hopefully here late April, early May, to offer a virtual class there. And it'll be just like you're in the room with me. You'll just be looking at a screen. So will it be the same class? We can help you make informed and prudent decisions to impact the quality of your life. So go to BroganFinancial.com. You can just stay tuned in that way. Also, sign up for our weekly e-blast, where I provide links to all of our content and material that we provide, our podcasts, my blogs, and informational offerings. Now, I got 6 ways to help others during this coronavirus outbreak. Everybody needs to be a responder in this crisis. How can we help others? And by the way, I'm borrowing from an article here on Market Watch, a great article here that was written by Leslie Albrecht, and it's just a great article. So, number 1, we can actually help get medical supplies shipped to where they're needed the most. There's an organization, a humanitarian relief group, Direct Relief. You can go to directrelief.com. And they've been shipping oxygen concentrators, which are devices that coronavirus patients can use to help them breathe at home rather than being hooked up to a ventilator at the hospital. And that's needed. That'll be needed if our hospital beds get overwhelmed. So that's just one thing that they do. So, just as an example, since January the 1st, Direct Relief has provided almost $1.5 billion of medical aid, 260 million doses of medicine, 7.3 million pounds of supplies, almost 27,000 deliveries. They have helped support over 2,000 healthcare providers. Unbelievable. That is directrelief.com. That helps get medical supplies in the hands of professionals and people that need medical supplies. Now, number 2, you could volunteer with Meals on Wheels. People are needing meals. They don't want to get out. Meals on Wheels needs to be delivering, and especially to people that are over age 60 need to be taking extra precautions. That isolation can have damaging effects long-term, can have damaging effects in the long term, and Meals on Wheels provides critical social interaction for many of its clients in addition to the meals. So many Meals on Wheels chapters are looking for healthy volunteers who can be on call to make deliveries during this outbreak. Many chapters also keep in touch with people at a distance through telephone reassurance programs. Social interaction is important, and our older people especially are going to see that social interaction completely dry up. And Meals on Wheels is putting a lot of places to get things together, not just delivering meals, but also speaking on the phone. Number 3, donate money to a reputable nonprofit. A great resource for nonprofits is Charity Navigator. CharityNavigator.org. They provide ratings on these charities. How effective are the charities at getting the money to the hands of the people that they serve? Are they giving 85, 90 cents on the dollar, or are they only giving 40 cents on the dollar? What is their rating? They rate 1 to 4 stars. They also give a score up to 100. So what is their rating? So if you're looking at local organizations or national organizations to help, Charity Navigator can help you then. Once you identify 2 or 3 that you really like, they'll help you figure out, are they good stewards of your money? And make sure that that as much of your money as possible goes to support people that are in need. Number 4, support your local food bank. Americans have been emptying the store shelves of non-perishables. The stockpiling has been so intense that many food banks have seen significant decreases in donations from retail grocery stores. So I know Feeding America has set up a COVID-19 response fund. And then you can check with our local food bank. But certainly helping with food banks is tremendous. Number 5, donate blood. The American Red Cross is urging healthy people who are feeling well to donate blood or platelets. There's no evidence that the novel coronavirus can be transmitted through blood transfusions. According to the Red Cross, find a donation site and donate blood. And then finally, help people experiencing homelessness. People without homes face a very significant risk from the coronavirus. They have poor health in general. They often suffer from sleep deprivation, often have pre-existing conditions that leave them with weakened immune systems. So it's a significant risk among the homeless. We have some great charities here in Knoxville. Certainly CARM, Knox Area Rescue Ministry, jumps right to mind at the top of the forefront of my mind. But this is all bigger than any one person or one person's ability to help. So anything we can do to help reach out to people in need. Now, another thing you can do is help support local businesses. Buy gift cards, especially local restaurants. You can buy gift cards to use later. The restaurants need that right now if they're going to stay in business. All right, well, you can order takeout. They're at least able to employ enough people to cook food and provide takeout or delivery. Anything we can do to support our local business. And please, if you know people that you love that are in nursing homes, assisted living facilities, they're pretty shut off right now. Be calling them. FaceTime is your friend. You can be visiting with them via video through your phone. God bless all of you in this trying time. Let's reach out to those that need help. Let's use this time to bond with our families and friends at home as we don't go out. And please stay healthy. God bless you. God bless Knoxville. God bless everyone in the United States of America. Have a great day. This is More Living with Jim Brogan on News Talk 98.7 WOKI.
The views expressed by Jim Brogan and his guests are not that of Cumulus Media. Any discussion of financial, legal, and tax planning strategies is not intended to be individualized advice and is general in nature. Always consult with your advisor for advice specific to your needs. This program's content does not represent a recommendation of any particular security, strategy, or investment by Jim Brogan or Brogan Financial Incorporated.